One of the things that needs to be remembered is that pain is not what we were taught. There's a lot of medicine that's not what we were taught, but especially pain is not what we were taught. And so we do all these things for pain, we ask all these questions, but most of them aren't relevant. Most of what we do isn't relevant. And the way we understand pain is not the way our body works. I remember hurting my own lower back on the Nautilus low back machine in like 1983 or 4. So out of my own personal experiences with pain, I was able to learn how to make mine go away. And as I learned how to make mine go away with the courses and bodywork things that I learned and did, I learned that I could make most anybody's pain go away by understanding pain a very different way. So the 5 rules are these. Rule number 1, you cannot believe that pain comes from where you feel it. Your headache does not come from your head, your blood vessels, or your nerves. Rule number 2, your brain can't tell the difference between numbness, tingling, burning, itch, tickle, sharp, dull, achy, stabbing. They all come from the same place. They all come from the same kind of injuries, and the difference is not significant and doesn't matter. Rule number 3, at the end of the day, the only thing you can really believe is what you can touch and feel. And what counts most is where specifically, millimeter by millimeter, are you tender. Rule number 4, the places where you are overall most tender represent the kinks and injuries through your lifetime that generate most of the pain of which you are conscious. And rule number 5, better than 90% of the time, no matter how long you've had the pain, and no matter what you think is your diagnosis, 90% of the time, by dealing with the kinks and the injuries, you can make most of your pain go away most of the time. Because by the time you unkink your strings, and by the time you strengthen and heal your anchors, the pain will already be gone. So the next question became, how do we teach this? And how do we help you understand what I've learned? Because in my first visit, I have a personal trifecta. In your first visit as a patient with me for pain, you will come to understand where the injuries are through your lifetime that cause the pain that makes you suffer. You'll come to understand what your biology needs to do to make that pain go away, and you'll be started doing some of that, and some of your pain may already be gone before you walk out the door on your very first visit. We try to hit that mark on every new patient. When's the last time you hit that mark on any patient in pain with standard of care that you've learned? Because everybody's doing standard of care, and standard of care is about how to cope. You don't want to learn how to cope. You don't want to manage pain. You want to make pain go away. So, Module 1 is head, neck, and TMJ pain. That's the easiest place to get started because it's the easiest place to touch and feel. You can touch and feel it yourself as you get more experienced in just starting out, because you're going to learn this on your own body. And then the first trigger point injections, they're the safest because in head and neck pain, we're using inch-long, really skinny needles, maybe 1.5-inch long needles, and that's most of it. The second workshop, you're assumed to have completed workshop 1. So now we're going to do chest, shoulder, upper extremity, all the way to the fingertips and the upper back. Now you're going to use 2-inch needles. You're going to be putting the needle into places that you have to know where the end of that needle is. It requires a bigger skill set than class number 1. So it takes class number 1 before you're ready for module number 2. Module number 3 is bigger. That's lower back pain, hip, lower extremity all the way to the bottom of your feet, and abdominal pain. Now you're going to use maybe even a 6-inch needle, and you're going to have to feel something that's the size of a grain of rice that could be 6 inches under the skin. Module 4, that's going to teach some more complex pieces like how do you reverse the scoliosis? How do you deal with pelvic pain? Because pelvic pain is not pudendal neuralgia. The nerve, the disc, the spine don't cause the pain. Most all the pain in your body comes from injuries to your fascia, a lifetime of injuries through your fascia. And then Module 5. Module 5 is injection techniques that you didn't have the skill set to know in Modules 1, 2, 3, and 4. It's the highest end of how all this work gets put together.
I've been aware of Dr. Blatman for years, but I never realized how much I was missing in my field, in my area, treating chronic pain, basically. I knew there was something to do with that diet and so on. I ignored it.
I just actually heard of Dr. Blatman a couple of months ago. Over our subsequent conversations, he let me know that he was hosting this course, and I was like, oh yes, absolutely, sign me up. And so I came down here, and it has been a phenomenal experience. He makes the most complicated things seem so simple and milks it down so that you understand the basics and the fundamentals.
I was able to get enough relief from my patient 90% success rate track. That's good enough. But I've been missing it a bunch. I'm learning a whole bunch. My mind is blown. I'm processing all the stuff that would take my practice to treat autism up. And I was not that low to begin with.
His approach fits, right in line with kind of the way I think of things. Diet and nutrition is always key. And I too, like he says, you've got to change the diet, and that itself makes a huge difference. Yeah. And so with that fundamental, his technique that he has developed with releasing the trigger points, it is something that I'd never seen or heard of before.
But to think I knew much to what I know now after 2 days, I think I knew 10%. 90% I was missing.
So I was using prolozone for a number of years with some, I would say, pretty decent results. And so I think this is going to allow me to take that to a whole new level.
So it's an absolutely wonderful course. Come in as an open mind. Come in as an open mind, and there's no limit to the wealth of knowledge from Hal.
And in each class, you are the patient. I'll bring patients into the class if I need specific examples, but most of the time, there's enough people in the class that we can all teach each other and we can learn on each other's bodies. And yes, you'll get yourself treated while you're in the class. And sometimes that'll just be trigger point injections. Sometimes it'll be prolotherapy. Sometimes it'll be prolozone. Sometimes it'll be PRP. It might even be stem cells. Because the needle techniques are very similar, and you need to learn this entire gamut in order to treat these most complicated of patients. And then support through the year. Video support, conference support, webcast support, to help you with your problems and your problem patients through the years based on the techniques that you learn in these 5 modules. Love to have you in the class. There's so much to learn, and pain is not what we were taught.